Thank you, Chip. Part of dealing with the first Ebola case diagnosed in the U.S., a case here in Dallas, requires tracking down the patient's close contacts. Zach Thompson, the director of the Dallas County Department of Health and Human Services, joins us with more details on that process. Thank you again for being here. We do know a CDC team is here assessing family members or anyone who may have come in contact with this patient. Do you expect we're going to have another case? I mean, is it just a matter of time?
Well, it's always a matter of time when you have a situation like this. So right now, we're glad that the CDC is on the ground. We'll be meeting with them today to look at moving forward with enhancing our contact investigation and surveillance of those individuals who had close contact with the patient. That's part of public health follow-up. We do this every day, whether it's foodborne illnesses. You may be looking at finding 50 to 100 people. In this case, we've narrowed it down to at least 12 to 18 people. As I pointed out before, 2.4 million people in Dallas County. We're only focused on 12 to 18. We're going to contain this situation. We're going to calm the Dallas County residents' fears. So we want everybody to move forward, but there is a process that we have to begin today and continue in terms of surveillance. Well,
I know that anybody that you decided has come in contact with this person, you're asking them that they stay at their house. The paramedics, for example, you have mentioned that they've been told to stay home. Are they isolating themselves from their friends and family as well? And is there someone making sure that they're not leaving their house? I think that's the fear of some.
Well, I think the fear should not be there in the case that they've been asked to stay at home, and they're going to be involved in close contact with their family members. But there should not be any outside contact, and no one should have fear about this because they're not, you don't see bodily fluids. This is the key point, is that we're talking about a virus that can only be transmitted through bodily fluids. And so the person is not have any symptoms, then they won't be, the transmission will not take place.
When you say bodily fluid, I think our viewers want some more on that too. Is that if someone who has Ebola sneezes on me or coughs on me, because that technically is sort of a bodily fluid?
Well, I think, it could all be considered bodily fluid, but in terms of what we look at is secretion, blood, and so close contact with a person for a period of time would constitute that exchange of bodily fluids. In this case, the sphere of people that this individual came in contact with is so small, everyone else should not even be concerned. And so unless you've actually know this person and have been involved with him, we already know who you are and we're following up with you.
Yeah, a lot of talk about the fact that this person was boarded a plane, flew here from West Africa, at that time did not show any symptoms, then got here in the U.S. and that's when he started showing symptoms. A lot of talk about, are they screening these passengers enough that are going to be flying over from West Africa? CDC says yes, that there's a process in place and that it's working. Do you agree with that?
Well, I go with the top docs at CDC. I think the question is on a third world country doing the evaluation versus a 21st century country like America with our medical infrastructure. I trust our medical infrastructure, and that's where I think the whole process should take place. The screening on the other side of the continent may be fine. I don't think it's sufficient based on the outbreak or based on the one case we have here in Dallas County.
How far are we from a vaccine or getting some more of this experimental drug that has worked on Ebola patients here in the U.S.?
Well, they're saying it's being developed, so I don't know a time frame on it. Of course, that's one of the discussions I'm sure that Dr. Friedman at the CDC will probably have in upcoming days. We definitely need a vaccine. We see these emerging viruses in the 21st century coming from third world countries, and all of them, whether we're talking West Nile virus, chikungunya, now Ebola, we always have to say there is no vaccine for humans.
Yeah, but it's something that's being worked on, so that is promising.
Yes.
All right, thank you so much for your time. We appreciate it. We have links to more information from the CDC, the World Health Organization, as well as the Dallas County Department as well of Health and Human Services. We have that on our website, myfoxdfw.com.